Good afternoon. My name is Allison Traeger, and I am one of the territory managers at Ajinomoto, Canberra. Today's presentation is regarding insurance coverage and open enrollment and how to navigate through the process. While I myself do not have PKU, nor do any of my family members, I do have an awesome 4-year-old son with special needs. And understanding insurance coverage was vital in order to provide the therapies that my son needs to thrive. Anytime someone has a medical condition, whether it's PKU or something else, it is extremely important to understand the basics of insurance coverage and how that may impact which insurance plans are best for your particular family's needs. I will be turning off my video camera so that you guys can focus on the slides versus me, but I will be joining you along with my panelists later on in the presentation. So for today's agenda, we're going to be giving an overview of different insurance terms and what that means for families. We're also going to be going over open enrollment, what that also means, what type of questions families should be asking during that time period to figure out the best insurance plan for them, how to determine the best insurance plan with respect to calculating out the overall cost for the year. And then we will also be having a panelist question and discussion period afterwards. If at any time you have any questions at all about the presentation or during our panelist discussion, please put your questions in either the chat box or in the question and answer section, and we can certainly answer those questions for you. So when we hear the term state mandate, it can be confusing because not all states are the same. Currently, there are 39 states that have passed legislation that requires insurance companies to provide at least some coverage of medical food. Now, the term medical food is important because this doesn't necessarily mean low-protein food. Medical food is defined as foods that are specially formulated and intended for the dietary management of a disease that has distinctive nutritional needs that cannot be met by normal diet alone. Some mandates consider this to be both low-protein food and medical formula, while others consider this just medical formula. So an example of medical food would be glycactin ready to drink or glycactin buttermilk. In addition, mandates must provide some coverage, but coverage doesn't mean that you will not have to pay anything. It depends on the state, which is why it's important to check to see what your state will mandate and cover. So mpkua.org, and I have put the internet link below, is a really great resource to look at each individual state to determine if there is a mandate, as well as what it will cover. So I wanted to give an example of a particular state that does have a mandate. So New York has a mandate for both low-protein food and formula. The mandate states that the insurance has to cover $2,500 for low-protein food. But the interesting thing that with respect to formula, it only says that they have to cover it. That does not mean that the individual won't have some responsibility with respect to paying something for it. So that's why it's really important when looking at insurance plans to figure out what the best plan is for you. So now I wanted to go over some different insurance terms that many of you will hear quite often when dealing with your formula or your food coverage. So a covered benefit tells you whether or not a service or a code for food or formula is included in your insurance plan. Covered benefit does not mean that you will not have some type of responsibility as far as paying, just that it either is or isn't allowed on your insurance plan. In-network means that your provider, either a physician or a DME stands for Durable Medical Equipment Company. An example of that would be Edge Park or Quorum. They have a relationship with the insurance company and have agreed to provide services to you based on a negotiated or set price. Typically, with in-network providers, this will cost patients less money than if they were to go out of network. So it's always advisable if you can for you to find an in-network doctor, an in-network hospital, an in-network DME, because it will save you money in the long run. An out-of-network provider, they haven't established a discounted rate for services. So while your insurance plan may allow you to see those doctors or use those DMEs that are out of network, they haven't negotiated a contracted rate, and therefore you typically have to pay more for whatever service you are looking to get, whether that is formula or going to a doctor. So the word deductible is really important and not always understood. So deductibles are the initial amount that you, the member, are responsible to pay before your insurance will begin to pay part or all of the service you need once it's considered a covered service. So deductibles range in price based on the insurance plan. Some insurance plans may have a $500 deductible, and some may have a $5,000 deductible that you have to pay. Even if there is a state mandate, depending on your insurance, you may still have to pay your deductible before your insurance will even begin to cover, meaning pay a part or all of your food or formula. And it's for this reason that it's really important for you to look at your plan and understand what each part of your insurance plan means. Coinsurance is the percentage of a medical benefit that you are responsible to pay. Your insurance will pay the provider a portion, and you have to pay a portion once you have met your deductible. So the percentage varies depending on each plan, as well as whether or not you're choosing an in-network provider or an out-of-network provider. So in-network providers typically have a better percentage that you are responsible to pay versus an out-of-network provider. So for example, if you're using an in-network provider, you might hear that there is an 80-20 coinsurance. What that means is that once you have paid your deductible, the insurance company will pay the provider 80% of the cost, and you would be responsible for the remaining 20% of the cost. So let's think about this as an example. If you were buying low protein food through Canberra, say you were buying $100 worth of low protein food. If you had already met your deductible and there wasn't a state mandate that covered the entire part of your food, if you had met the deductible, 80% of that $100, the insurance company would pay, which is $80. You would have to pay the remaining 20%, which is $20. Again, out-of-network benefits tend to have a higher coinsurance. So instead of an 80-20, it might be significantly higher for you, which is why it's really important to try and find an in-network provider for your formula and your food. Patient responsibility, that's the amount that you are responsible to pay the provider being your doctor, the DME. That is your portion that you have to pay them, and they will bill you to receive that payment. Copays are different than coinsurance. So coinsurance, like I said before, is a percentage. Copays typically are for a prescription or for a service and are a flat dollar amount. So you may find that once you have met your deductible to see a doctor, instead of having a percentage, you might pay $20 or $30 to see them, or $50 for a prescription to be filled. The term plan exclusion is also really important to understand, because what a plan exclusion means is that, unfortunately, it's not covered by your insurance plan. So if you were trying to get formula or food covered by your insurance company and they tell you that it's a plan exclusion, if you needed the formula or food, you would be responsible for paying the entire portion of that bill. The insurance company will not pay any of that. And then explanation of benefits can sometimes be confusing as well, because many people think that this is actually a bill, and it's not a bill. The insurance companies will send you this as a summary of the service that was provided. So the explanation of benefits will show you what your provider billed the insurance company, if there was any type of negotiated discount, what your insurance company paid the provider, and then what your responsibility still is to pay that provider. So the next thing that I want to talk about is open enrollment. Open enrollment occurs once per calendar year, typically in October or November. So we're kind of right in the middle of when open enrollment is. What insurance plan you choose during open enrollment is the plan that you have for the entire year, which is why it's so important to pick the right plan. Because if you pick the plan that doesn't meet all of your medical needs, unfortunately, that's the plan that you have until the next open enrollment period. Now, the only time that you can change your insurance plan is if you have a major life-changing event. So if you give birth, if you adopt a child, if you get married, or have a death in your family, or a divorce, or a loss of job. Those are some examples of when you can actually change your insurance throughout the course of the year. But since you typically can only pick your insurance plan once, it's for that reason that it's so important to ask questions during the open enrollment period. So if you have any questions or concerns about your PKU needs, you need to ask either someone from your human resources department or a benefit specialist that is assigned to your employer. I myself have used our benefit specialist numerous times, most recently this week, to ensure that my son's services were still covered under our new insurance plans or options, because I knew that I needed to make sure that all of my son's therapies were still going to get covered on these new insurance plans. So certainly reach out to them. But some of the questions that you're going to want to ask during this open enrollment time are the PKU formulas or low protein foods covered on each of the plans that are being offered to you? Is there an age limit? So, you know, many times the insurance companies will say that, oh yes, those codes are covered, but you also have to ask them if there is an age limit, because some insurance plans may only cover low protein food or formula until the age of 1 or until the age of 8. And if you are past that age, then it's actually not a covered benefit. So it's really important to not just ask if the low protein food or formula is covered, but if there's any age restrictions as well. And in addition, you also want to make sure that you find out if there's a maximum amount that is covered under each of the different insurance plans that are being offered to you. Another thing to talk about with your human resources or benefits specialist is that formula sometimes may be covered as a medical benefit or a pharmacy benefit. And they may not have the answer right away, but if you can provide them with the specific B codes or S codes, they can then look that information up for you and let you know whether or not those specific codes are covered under each of the different insurance plans that are being offered to you for open enrollment. So what happens if formula and food isn't covered on the plans that are being offered to you through your employer? You want to talk to your manager and the human resources department. You want to explain to them and encourage them to add those codes into the coverage. Explain to them what PKU is and how taking the formula and eating the low protein foods are essential for your family. You also may want to give them some examples of what the cost of food is. Because they don't know, they really probably will think that a loaf of bread that's low protein is going to cost the same as a loaf of bread that you get at a supermarket. And we know that that's not necessarily the case. So you have to really explain to them what PKU is and what the diet entails. And then what you're going to want to do is ask your company if they're willing to write a rider covering the formula or the low protein food. So a rider is an insurance policy agreement that adds the specific benefits or codes onto that insurance policy so that your formula or food can be covered. So how do you pick the right plan and what things you need to be asking yourself? So does the employer offer more than one insurance plan to choose from? Many of the options, there may only be one option with your employer, but there are other employers that might offer 2 or 3 different options. And what you want to do is you want to check to make sure that food and formula are covered under each of those different plans. And if you find out that one of those plans are not covering the formula or food, that might not be the best plan for you, because we know that formula and food is vital when managing different inborn errors of metabolism. So you want to make sure that a plan that is offered has the low protein food and the formula covered. The other thing that you want to think about is what are the premiums and what are the deductibles. So a lot of people think that they're going to pick the lowest cost premium, insurance premium, or the plan that has the lowest deductibles. And many times when you pick a lower deductible plan, that might in the long run turn out to be more out of pocket for you over the course of the year. And I'm going to show you some different examples of that and what to look out for when open enrollment comes around within your company. So you want to look at what the deductible is, how much it is, and then what would be your responsibility, or what would you need to pay for once your deductible is met. So again, when picking out the right plan, you want to talk to your benefits specialist or your human resource person. They're going to be able to answer a lot of your questions. You want to ask questions. You have a right to know. This is the most important time that you have when picking out an insurance plan. There are no silly questions whatsoever. any question that you think is important is important. And that's why I really suggest making a list of different questions that you want to ask your HR person or benefits specialist so that you don't forget something. Because the last thing you want is to not have all of your questions answered. And then lastly, if for some reason you don't have someone in HR that can answer your questions, or your employer doesn't offer a benefits specialist to speak with, you can always reach out to the different reimbursement programs such as Canberra Care, and we can, work with you to figure out what would be covered under those different insurance plans. And you can contact us at reimbursement@canbrook.com. So I wanted to give you two examples of two different medical plans. So these are made up plans. They're not, your actual plans that you're going to be looking at when it comes time for open enrollment. But what it does do is give you an idea of what things you should be looking out for when it's time for you to pick an insurance plan for your family. So you can see that in the dark blue, we have a high deductible health savings account plan. And with this particular plan, you have the option of using an in-network doctor or DME, or an out-of-network doctor or DME. In the light green, the insurance plan is a PPO in-network plan. And that's also very important because it will only allow you to see doctors or DMEs that are in-network. If you decide to use a doctor or a DME that's out of network, the insurance will not cover any of it, and therefore you are responsible for 100% every single time you see a doctor or you get any type of formula or food. So you want to make sure that any DME that you're using or any doctor that you're going to see, that if you're picking an in-network only plan, that those doctors are in your plan. You're going to want to look at annual deductibles. So in the high deductible health savings plan, you can see that the deductible for an individual or a family is either $2,000 or $4,000. Now, this is a lot of money, but something to consider is that many times your employer may actually contribute to your health savings account plan. And so even though it's $4,000 for a family, that might not be your entire out-of-pocket if your company is willing to contribute some money for that. So you want to ask that question as well. For a PPO in-network plan, the deductible is $500 or $1,000 depending on the family. So a lot of times people will look at this and say, oh, I'm going to pick the PPO in-network plan because it's a lower deductible. But you have to look at all the other things that are part of that plan and all of your different medical expenses to figure out which plan is going to provide the most amount of benefits, but also the lowest amount of out-of-pocket for you. So for this particular plan with respect to office visits, once you pay your deductible, this particular plan is going to pay 100% of the office visit. So after you pay your $4,000 deductible, every time you go see a doctor that's in network, you wouldn't have to pay for anything at all. But if you were using the PPO in-network plan, once you paid your deductible, every time you went to a doctor, a primary doctor, you would have to pay $20 each time. And if you went to a specialist, like a geneticist, you would have to pay $50 each time. So it's important to also look at the cost if you were to go to an office visit to see a doctor. Medical benefits are also important to look at. I would say 90% of the time, Formula and food are going to be covered as a medical benefit and not a pharmacy benefit. And so you need to find out in your plans what your out-of-pocket is or what you're responsible for your formula and food with respect to medical benefits. So with this high deductible health savings plan, again, once the deductible is met, you don't have to pay anything else because your insurance company is going to pay the provider 100% of the cost. But if you were to choose the PPO in-network plan, after you paid your deductible, the insurance company would pay 80% and you would be responsible to pay 20% each month if you picked this example insurance plan. So I wanted to give you an example of what this all looks like. Again, these are examples. These are not real life situations. These are all made up, but it allows you to see how to calculate when you have different insurance plans, what the best plan is for you. So this is the Smith family. So they are a family plan. And with the high deductible health savings plan, their insurance premium, which is what they have to pay from their paycheck each pay period, is $125 every 2 weeks. So that amount comes out to $3,250 a year. We all have to pay some type of insurance premium when it comes to insurances. Unfortunately, that's just the way that it is. But you also want to look at the deductible, right? So the deductible for the high deductible health savings plan is $4,000. And once they meet that deductible, the office visits, their medical benefits for formula and food are all covered at 100% if they go in network. If they go out of network, it would be, you would have to pay a percentage. So let's say the Smith family needed their formula and it was going to cost them $2,000 a month. In January, which is when the insurance typically starts back up every January, the first month, the Smith family would have to pay $2,000, and that would go towards their deductible. In February, they would have to pay another $2,000, again, because it has to go to their deductible, but now their deductible is paid in full. For March to December, because their deductible had been met, the insurance company pays 100% of their formula. So they don't have to pay any more for the rest of the year. So their total formula cost would be $4,000 a year, plus the total insurance premium, which is $3,250, which for a total of $7,250 for the year. The one thing to also keep in mind is that with this insurance plan, they don't have to pay anything for their doctor's visits if they're going in network. So that also is going to save them money. So for the entire year, they would only have to pay $7,250. Now, some people may be thinking, I don't have $4,000 all in January and February, and that's a lot of money. Something to keep in mind is that the majority of durable medical equipment companies do offer payment plans. You just have to ask them for it. They will not offer it up, but if you say to them, I can't afford $2,000 all in 1 month, they can set up a payment plan for you over the course of the year, but all of that is still going towards your deductible. And in March, you still wouldn't have to pay under this example insurance plan. Now, what happens if the Smith family decided to use the hypothetical PPO in-network plan, right? So they would have the $1,000 deductible, and then their medical benefits would be that coinsurance, that 80-20. So again, the formula hasn't changed. It's still $2,000 a month. And in January, they have to pay that $1,000 deductible. So they pay that $1,000 deductible. and there's still $1,000 left in the remaining balance of their formula. So they would be responsible for 20% because the insurance company would cover the other 80%. So $1,000 for the deductible plus 20%, which is $200. In January, they would owe $1,200, and their deductible is now paid. Again, you can still ask the DMEs if they have a payment plan option, if you can't afford that $1,200 that first month. In February to December, which is 11 months, once the deductible is met on this example of a plan, they have to still pay 20% of that $2,000 each month. So that would be $400 each month. So $400 for 11 months is $4,400. So when you add that all up, you have the $1,000 deductible, you have $4,600 a year for the formula, and you also have the total insurance premium, which is $3,900. The total annual formula cost for this family would be $9,500. But what about the doctor's visit? So on the high deductible health savings plan, it was covered at 100% if they went in network once they hit their deductible. For this plan, they would have to pay a copay every single time they went to their doctor. So let's just say that if you went to your geneticist 3 times a year, that would be $150. And the family on a whole went to their primary doctor 10 times a year, whether it's for, they're sick, they have the flu, they think they may have strep, they might have an ear infection. That would be $20 for 10 times would equal $200. That adds up to $9,850 a year. But for this PPO in-network plan, there's an out-of-pocket maximum. And an out-of-pocket maximum means the most that you are responsible to pay, that's how much you have to pay over the course of the year. So you would actually only have to pay the $9,700 instead of the $9,850 for the year. So let's compare the two plans. On the high deductible HSA plan that had the $4,000 deductible, this family would have to pay $7,250 over the course of the year. If the family chose the PPO in-network plan, they would have to pay $9,700 because they hit their out-of-pocket max. So you can see here that a lower deductible insurance plan over the course of the year may actually be more expensive for a family. So you always want to do your math. You want to consider all aspects of the plan to make sure that all of your needs are being met and that you're able to save as much money as possible, for each insurance plan. So some of the key takeaways for this, you want to understand what insurance words mean. Remember what the deductible means. Remember what the coinsurance means. Remember what the in-network means. You want to make a list of all the questions that you want to ask during open enrollment. You want to take the time to calculate the different plans. And if you're struggling with that, ask. Talk to your dietitian. Talk to maybe a family member that might be able to help you out with that. Or even, call Canberra. We can certainly help you in trying to figure out what plan might be the best thing for you based on your family's needs. So now I want to open it up to our panelists' questions and answers. We have some questions that are standard questions that at Canberra we hear quite often. And then obviously if you have any additional questions, now's the time to enter them either in the chat box or in the question and answer session. I'm going to ask everyone who's part of the panelists to get back on camera, and I'm going to introduce each of them. So first, I'd like to introduce Bridget Tomick. Bridget is our Canberra metabolic clinical specialist. She's worked in the metabolic field for over 5 years, and she's worked with a number of families to get their insurance to cover low-protein food and medical formula. Vanessa Austin is our reimbursement specialist. Many of you have probably spoken to her or have emailed her to ask her how to get your food or formula covered. She's been in the reimbursement area for the past 4 years. And then lastly, I'd like to introduce Shane Osterman. Shane is a dad to 2 beautiful children who have PKU. He's currently the president of the Iowa PKU Foundation and was a former board of director for NPKUA. He's also spent countless years working to try and get his own kids' food and formula coverage. And he's also been a big resource to many families struggling to get their food and formula covered. So one of the questions that we get are what resources are available to help determine if food and formula is covered through insurance? So I thought that Vanessa might be a great person to speak about that.
Hi, hello everyone. So some resources available to you is first and foremost, you can go to the National PKU Alliance website, npkua.org. That's a great all-inclusive resource that's going to have your most up-to-date information on state mandates, where things stand, things you can go to. It's also a great website for advocacy, for getting benefits, all that. So I strongly encourage any affected family to utilize it, see what information is out there, and get active. Another resource you could use for finding coverage is you could contact your family dietitian. Your dietitian is going to be a great resource for what has worked in the past in your area, whereas the PKU Alliance is more all-inclusive. Dietitian's going to know, maybe they had a patient with that same insurance before, same type of scenario. They may know, an in-network provider that could be utilized, something that hadn't been thought of. So they're also a great resource to you. And then you also have your team at Canberra. There's the Canberra Care Team. I'm part of that. So we're here to help. We look into benefits, all that. We may know of some updates and can offer suggestions. And then there's also your territory manager that can be helpful to you as well.
Great, thanks, Vanessa. Another question that we get quite often is, my human resource person has never heard of these codes. Is there some written documentation that explains what these are that I can present to her? And I thought, Shane, you might be able to talk a little bit about that.
Yeah, thanks. So whenever I'm talking about anything with PKU with anybody, I think it's always really, really important to start just with the very basics. What is it and why is it important? So I provided 2 links here. I always like to go to something that somebody knows, and most people know what the Mayo Clinic is or WebMD, and just provide a list of the information, kind of the generic what is PKU. And I also have the NPKUA.org what is PKU, because I think they do that just has a ton of information on it that's very helpful. The other thing that I always like to do is actually compare it to something that most people have heard of and know. And one of those diseases is juvenile diabetes. So, and in a lot of ways, juvenile diabetes ends up being a nice proxy for PKU in the sense that most people know about it. The cost of care is quite similar. And also, you can relate the medical food in some ways to what insulin is for a kid. and that has juvenile diabetes. And that can kind of bring it home to people a little bit to understand it. And then the second piece of, after they kind of understand what it is, the second piece is to help them understand why it is important to have coverage. So how to get coverage is kind of the third question. I think what it is and why it's important are the first two, and that's how you get buy-in. So the first thing that's listed there is just the retail list of what the price is. So compare the price of a loaf of bread to what it is for, for PKU compared to at the grocery store, and how it's significantly more expensive. The one thing that I always try not to do, though, is make it seem like it's too expensive. So most of the time, if you're talking to somebody in HR, one of the things that they deal with is they're negotiating the health insurance for the whole company, and they don't want to hear how expensive something is going to be to cover it, because they probably have some responsibility for the budget of some type. So I think it's really important to note that it is much more expensive than what it is to go to retail. But in the medical realm, the cost of treating PKU using food and formula is actually not that expensive. In fact, it's usually less expensive to treat PKU with food and formula than what it is to enable or allow somebody to go off diet. And that's true for both kids and adults. Most of the people who go off diet have significant other health expenses that end up accruing, and so it's actually cheaper to treat it. And that's something that's really important to make sure that they know. In addition to that, it's simply the right thing to do. This is for my two kids. This is their brain we're talking about. So it's one of the most important things to me as they grow. So, and I think everybody can kind of relate to that. So if you could go on to the next slide.
Yes, before I do that, Shane, though, we have talked about this in the past, that you like to put together a folder for your employers. What kind of things do you typically include in that folder?
Yeah, that's a really good question. One of the things that I like to always include is just some general information. Normally, like the American Academy of Pediatrics has an article that they seem to release quite frequently that kind of gives an update of why PKU is important and the barriers to treatment. And in fact, I think the most recent one was written in February of this year, and it's actually one of the authors is actually the executive director at the NPKUA. So that's a great resource to have. Another thing that I always like to have is brought up earlier, that 39 states mandate some type of coverage. And when I'm talking to my employer, I'm coaching other people to talk to their employers, I always bring that up because it adds validity to the fact that the best way to treat this is to give people food and formula, and 39 states have come to that same conclusion. In addition to that, they may have employees that work in some of those states, and so it just might help them understand a little bit more of what's important. And probably the most important thing to have is a letter of medical necessity. So your clinician should be able to provide that to you, or your dietitian, one of the two will be able to write it up for you. And that's really, for the insurance terms, that really ends up being kind of the prescription that's needed for medical fees.
Great, thanks, Shane. I'm going to move on to the next slide.
All right, so the question was simple. Well, what are these codes? And I took a long time explaining why I think it's important to explain the why PKU is important and what PKU is, but the actual how things get processed is right in front of you on the slide. So basically everything, anything medically related has some type of a code. And there's some examples on your screen right there of a couple different codes that are used. What's really important to understand is that most insurance policies will dictate what is covered by using those codes. And so it's really important that your clinician is writing your prescriptions and what's going on using one of these codes, and also that they understand how your insurance is using it. So if your HR isn't really completely clear on it, they might have exclusions, and a lot of times those exclusions might include these codes. It's just important to make them understand that this is really how kind of everything happens behind the scenes of how the shown. I know in my insurance policy, Walmart lists a few other ones, so there's a link there for you to take a look at that if you'd like. The other component about any of these codes is that essentially everything gets processed with a diagnosis and the treatment. So the codes that are shown there are the treatment. The diagnosis normally for PKU is really an inborn error of metabolism. And why that's important is because I know in my plan there might be a different condition that requires a formula, but my policy is specifically written to say that they'll only cover the formula if it's for the treatment of an inborn error of metabolism, PKU is listed as one of those examples. So understanding the diagnosis and the treatment is really the two components of how insurance is actually processed payment.
Great. Thank you so much, Shane. I'm going to move to the next one, which is my formula is covered by the state program, but I want to get low-protein foods covered by my insurance through work. My HR person is telling me that none of the plans cover these things. What are my next steps or options to see if I can get some coverage for the food? And we hear this quite a bit. So, Shane, your input or your information would be really, really helpful on this.
Yeah, so before, again, this is where a little bit of background information is really helpful. So if you're getting insurance through your employer, traditionally it's going to fall into one of two categories. One is what's called self-funded, or an ERISA plan, if you've heard that term previously. And basically what that means is that the actual employer is paying for the claims. It's a little bit more complicated than that, but at the end of the day, they're responsible for paying the claims that come through. So, and what's really important about the ERISA plans is those 39 state laws, if it's an ERISA plan, they don't have to follow those state laws. So they only have to follow national laws. The other version of insurance that happens is really that the company is actually using the insurer to pay the claim. So they pay a premium and then the insurer pays the claim. In those situations, the state law is what's going to determine if there's a state law, then they would have to cover it. So first of all, understanding that nuance is really important. And it enables you to take two different approaches. If it's an ERISA plan, it's really important, I think, and when I've had success, is actually making sure that the HR and my manager, or I always advise people to go to, if you know a VP or the CEO, the highest person in the organization, to talk to them a little bit about PKU, what it is, and why it's important. And normally, I've had pretty good success of that. If the company learns about it, they generally want to do the right thing, especially when they understand that this is the cheapest way to treat PKU and that it will actually make their lives easier if they just cover it. If it's a fully insured plan, it's a little bit more complicated in doing that because really the insurance company is in control of that, and it's really dependent on the state laws and the types of things you can do to move forward from that. In either situation, though, you can ask the company. Actually, the company I work for, I help negotiate our insurance policy that we have for our employees. And there are times that you can actually add a rider in either situation to actually have the care covered. So be ready for that. Understand what type of plan you have, because especially if it's an ERISA plan, you should be talking to your manager or somebody who you trust that has some pull within the company as well as HR to help you get it through. And if they're saying that it's not covered, you can appeal that and be ready for that. And that's where that documentation that I mentioned before is really, really important. Understand what your state law is. Understand, potentially read through your policy that you have and see the other things that they might cover that may not be as important. I know there's actually some federal laws that require wigs to be covered if you have cancer. And while I think wigs are really important in those situations, and I'm not trying to understate their importance, it's probably not as important as making sure that my kid's brain is healthy. And I kind of lay that out as simple as that to them. I think it makes it very understandable. I've ran into situations where an employer said, well, this is food. I don't pay for food for other people. And it's important then to kind of ground that and say, well, actually, it isn't just food. This is how, in the case of formula, formula for a lot of kids, that's 70% of the nutrition, and if they ate normal food, they wouldn't be healthy. So this isn't just food, this is really their medicine. It's just like a diabetic's insulin to them. If they don't have that, they get sick, and that's what happens with my kids if they don't get access to their food and formula. So, have that information ready, and I can definitely help you with that. I think we're going to try to get some information out to people's hands of some examples of some key articles. So we'll be on the lookout for that. And then if you're denied that appeal, I think it's really important for you to look into whether or not you can get an external review is sometimes what can happen. And sometimes actually even before you do an appeal, you can try to have a peer-to-peer discussion that basically enables the insurance doctor, whoever's reviewing it, to contact your clinician. And the kind of secret piece of insurance is that normally people who are reviewing this don't have any experience actually treating it. And your clinician probably is 10 times the expert of any doctor that they have on the insurance side understands. In fact, I can almost guarantee that that's the case. So that discussion sometimes can help the insurance company understand what's really going on and what is important, so they can get the fact that it's the cheapest way to treat it, and it provides the best outcome. So if all of that stuff fails, and so you've tried to do a claim, it's been denied, you've appealed, that's been denied, you talked to HR, that's been denied, I guess the best information I can give you, or the best advice I can give you, is just to never give up. Look into Medicaid. You might qualify and they might have coverage. Look into NORD. In the last year, NORD has increased the amount of support that they're giving for food significantly. I know a lot of people who have been benefited a great deal for that. Check with Canberra or other food companies to see if they have any specials going on, if they have any cooking classes that they're doing. So maybe instead of getting the expensive ready-made meals, maybe you can get some of the mixes and actually make it yourself and save a significant amount of money. Reach out to Canberra Care. And again, I'll go back to understand your insurance plan, read through it. If you need help reading through it and you're looking for somebody to help you out, I'm pretty easy to find in different places. I'd be more than willing to help out. See if you can do a state appeal. I've done that, where basically I took something to the insurance division at the state level. That might be an option. You might have to go to arbitration with them, talk to your HR department, and if all of that fails, contact your representatives. That can make a huge difference. We personally went through something where I had coverage for 18 months. It was a fully insured plan. All of a sudden, we got denied, and we had to pay all 18 months of that food and formula back. Or, I'm sorry, just food. It wasn't formula. The formula was still covered, but the food, and it was really expensive. And we reached out, and we asked other people to reach out to our local senator, who's Senator Joni Ernst. And while she didn't originally support the MEA, she actually signed on as the lead co-sponsor for the Republicans in the Senate, which was pretty important to get that bill introduced in the Senate. So, she got contacted 400 times in the course of a couple of weeks, and it made a difference. We have also done, contacted the news and gotten the word out that way. We've done news segments about teal pumpkins. We've done segments just about our school being great and helping our kids, getting their food going through the lunch line. We've had other times where we went out to D.C. and we, were fighting for coverage, and they did a news story about that. And those little things matter because they build awareness and help other people understand it. So you have to be your own advocate. You have to be willing to put it out there. And there's always people that can help you with that, whether it's the NTKUA, whether it's me. If you get an opportunity to share it and you're worried or concerned about sharing, reach out. There's a ton of people who have done it, and we're here to help out. We just want to build awareness whenever we can.
Great. Thank you so much, Shane. Someone told me that I need to call my insurance company myself to ask for Canberra to send the bill to them. I don't understand who I'm supposed to call or what to say. I don't understand why you can't just send the bill to the insurance. Vanessa, can you talk a little bit about that?
Yes. So the basis of how this would come about is a lot of times us at Canberra, we try to initiate what is called a network exception, where we try to get our services covered at the in-network level. The reason for this is because Canberra is out of network. Current regulations mandate that Medicare regulations are, this needs to be digestive. So currently we can't get in network with a lot of plans because we're held up with that. So our current network status with most plans is we are out of network. So the majority of the time, what we are able to do is move the coverage to an in-network level on a basis exception. That is, we need to make an argument with the insurance that there are no in-network providers that can do this service. The patient is forced to go out of network. They're not choosing to. This actually being initiated by the member with the insurance, I feel comes from a good place because this is the insurance wanting to check in with you. They want to make sure you understand that this is an out-of-network provider. Can you use an in-network provider? Why are you choosing? So it's really, in a way, it's a good way to touch base with their patients. It's rooted in a good thought. A good example of a payer that does this is Aetna. A lot of Aetna patients have to do this. But once initiated by the member, Canberra can then step in, provide supplemental clinical information, all that, and make a case once the member opens the door and understands what this may mean for them. So the goal is always to get it covered at the best network level that we can to minimize costs on the patient. This encourages you to become your own advocate, push for what you're entitled to if we can get it. So obviously, in-network status is the goal, if the plan allows for it. With this process, we are here to help. It's unfamiliar to a lot of patients. I know a lot of patients avoid calling insurance. So we're happy to provide codes, provide guidance, do a three-way call with you, really walk you through the process. We want this to be as seamless as possible for you. But once you get it, you'll know the drill each time because they do expire and require initiation from the member each time. But we definitely are here to help. We can send you information on how to do it. And like I said, we will get on the phone with you to make this happen for you, to get that benefit if we can.
Perfect. Thank you. And then the last question on the presentation is, what exactly is Canberra Care and how can it help me? Vanessa?
Yes, so the Canberra Care process, any of our pre-established patients have probably seen this on top of our HIPAA release forms. That's what the Canberra Care process is what we refer to as, when we look, what we've described basically is researching the insurance coverage, okay, where do we stand with the insurance? Is it covered? Okay, is there 2 network levels? Can we get it approved in network? And for formula, a lot of times we're able to research if there's a pharmacy benefit. A lot of times with your plan, that may be the best benefit. Not all the time, but sometimes. So this is really, should we send it to an in-network provider? Can that be a little more seamless because we are the out-of-network? So we're basically trying to figure out what the best benefit is for the patient, and then how do we move forward with that? That's our Canberra Care process. We investigate solutions in cases of non-coverage. Shane and Allison touched on riders and hold harmlesses. So we do, if you need us to, we can call your HR or help you explain to them what you need. It's usually not an issue for larger companies, but some smaller companies, with more in-house HR where associates have graduated into an HR role may need a little help with this, and we're happy to do that. But if like what Shane said, if all else fails, we work with a lot of state programs. There's some clinics that have programs, so if all else fails, we want to help you get coverage and get what you need. So that's basically what the whole Canberra Care process is.
Perfect. Thank you so much, Vanessa. So that wraps up our presentation. I do have a few questions that were asked. One of the questions, and I know that we're right around the 4 o'clock mark, so but I do want to answer some of your questions. One question was, do copays usually kick in after you reach the deductible, or will you have to pay those before you reach your deductible? So typically what happens is that if you go, you always have to hit your deductible first. So if you go to a doctor's office and for that visit, it costs $150, you wouldn't be charged for the copay. You would have to pay that dollar amount in full until you actually hit your deductible. And then once you hit your deductible, then the copays kick in. So you always have to meet your deductible first. Now, if your insurance plan doesn't have deductibles and it's only copays, then each time you would have to go and pay a copay to that physician's office. But typically, you always have to pay the deductible first before you start paying with your copays. Bridget, do you have any other questions?
Have a few questions over here. Lisa asked a similar question. Insurance doesn't cover 100% until both deductible and out-of-pocket expenses are met. Is that correct?
So the out-of-pocket, no. So did she ask if it covers it? Does the insurance cover it at 100%?
Yes.
Yeah. So depending on your insurance plan, if your insurance plan with the co-insurance is saying that it's an 80-20 or a 50-50, your insurance company will not pay 100% until you've actually hit your out-of-pocket max. Once you hit your out-of-pocket max, then you won't be paying any more of it. But unless your insurance plan says that it's covered at 100% after you meet your deductible, you are still required to pay some portion of it until you've hit your out-of-pocket max. Great question.
Okay. Vanessa kind of talked about this but didn't define it. Is there such a thing as a gap exception with insurance?
Vanessa, do you want to answer that?
Yeah, I hit the wrong mute button. I apologize. Yes. So a gap exception is another word for the network exceptions. A lot of times if we're contacting you, you will hear us use that term. That is the term that they may use at the insurance company. But what it's doing is a network exception. So that whole process, whether it's member-initiated, clinic-initiated, or Canberra-initiated, is a network exception. So that's moving your approval to the preferred benefit level is what that's doing if we can.
Okay, and then just one final, a good one. Maybe Shane will have some advice on this. I have an open access plan that doesn't have a network. They are generally pretty good at covering things, but the DME had no idea how to determine if low protein food was covered. HR was also unsure. I'm not sure where to go from here to find out.
Well, the first thing I would ask in that situation, that's right up Canberra Care's alley, right? They can help you read through your insurance plan. If you're like me and you're kind of a glutton for punishment, I like to actually read through the insurance so I understand it. So I actually read through it. There's some keywords to look in a policy if you do get it and you're waiting for Canberra Care to get back to you. Look for something that says inborn error of metabolism, and it will normally be there. A lot of times it's under durable medical goods, which seems really like a crazy place to put an insurance policy, but a lot of times that's where you can find it. Some policies will actually have something that's called a medical food policy that you can look at it and you can kind of read through it and understand it. But the first line of defense would be Canberra Care, and then outside of that, if you like to read through it and understand it, you can do it yourself. Or, like I said, I'm pretty easy to find, and I like reading as many different policies as possible because it helps me understand it better and what different areas are doing it. So if you're completely flummoxed, you can always reach out to me too. You can find me on basically any social media platform some way or another.
And Shane, what I can do if you're okay with it, I can send an email out to everybody with your email address if you're okay with that, if they want to reach out to you, if you're okay with that.
Completely okay with that. Anything I can do to help people.
Great, thank you. Any other questions, Bridget?
That's all I have over here.
Great. So I just wanted to thank all of you again for attending this webinar. We all hope that you found it informative and useful. You know, we are one big community, and we want to make sure that we can help everybody get the formula and the food that they need to be the best version of yourself. And so if there's anything that we can do to help you navigate this, please don't hesitate to email us. Again, we can be reached at reimbursement@cambrook.com, or you can also give us a call, and we'd be more than happy to help walk you through all of this when your time comes to picking an insurance plan. So I just wanted to thank our panelists again and thank all of you. Have a wonderful weekend. Be safe, be healthy, and we will speak with you soon. Bye-bye, everybody.
Thank you.
Thank you.